Now, following the Ebola outbreak in Central Africa, 3 Mexican airlines have announced restrictions for travelers from the region. The curbs have come as Mexico is preparing to welcome fans and athletes for the World Cup in less than 2 weeks. Now, Aeromexico has said that entry into Mexico by air is restricted for travelers who have stayed in Uganda, the Democratic Republic of Congo or South Sudan in the last 21 days. The low-cost carriers Viva and Volaris have announced similar restrictions which are in effect for about 60 days. The Democratic Republic of Congo currently is battling the outbreak of the Ebola virus and is qualified for the World Cup and is scheduled to play its first round matches in the United States and Mexico. The World Health Organization chief visited the Democratic Republic of Congo. He was due to travel to Ituri, the northeastern province at the epicenter of the country's 17th Ebola outbreak. But the trip has been pushed back by a day. Uganda has confirmed 2 new cases. However, in some rare good news, a patient in DRC was confirmed to have recovered. This is the first since the outbreak was detected in the middle of May. It must be noted that no vaccine or treatment exists for the Bundibugyo strain of Ebola, which is responsible for the current outbreak. In terms of aid, the WHO received 4.6 tons of medical equipment and supplies in Ituri province on the 27th of May. And this included about 2,000 tests to fight the Ebola outbreak.
We came to receive 2,000 Radio 1 PCR tests, which were shipped from Kinshasa to support diagnosis here in Ituri in Bunia. We have a certified laboratory at the public health laboratory level here in Bunia. It's a laboratory that can diagnose Ebola disease. This laboratory has been operational since 17 May. All that was missing were reagents to begin working and confirming the samples from the cases that we are regularly receiving.
According to the health minister, the Congolese authorities say that they've identified about 1,028 suspected cases of Ebola. The number of confirmed cases is 225. Meanwhile, schools are trying to educate their pupils about the disease and the health measures to mitigate the contagion. Some teachers say that they are trying to raise awareness of Ebola amongst their students while also struggling to deal with the logistics. In the Bunia region, where facilities were burned down earlier in the month by protesters over the burial of an Ebola victim, reconstruction has begun. The workers, in fact, built new treatment sheds to replace those that were destroyed in May 21 in Rampara. And apart from health, the region is also now facing some economic challenges. The suspension of weekly markets at the border crossing between Uganda and the DRC has left the vendors in a bit of a lurch. The closure has disrupted vital cross-border trade, hitting those dealing in perishable goods. This comes as the local authorities have emphasized the need for preventive measures to avoid large gatherings. And although regular shop operations with safety measures are permitted. For all the latest news, download the WION app and subscribe to our YouTube channel.